Ufumapo na mrenji forokoroko mbwe mtumbo mwamba kukuwa mbwe utachunguza ndipanya ntere chimbuzi waka mbwe ufumakura mbwe na karabu kwa mbishaso mbwe mwa kwamba kupitilila paka pa umatiro pake.
Asimango pita tani toilet kuja nayamba utani kufumira kena kan kulowa so mnyumba ndeta ani zikhala bwino wayambilaso nde nalo waso kuto toilet nayamba so kutani sasa ndatani ndafoka nangoenda basi paka kuchipatala.
Greetings, my name is Hester Mkwinda Nyasuru. I'm the country director at Amref Health Africa in Malawi. Our vision is to create a lasting health change in Africa and in Malawi specifically. And our mission is to categorize and drive community-led and people-centered primary healthcare systems whilst addressing the social determinants of health. We've been working in Malawi since 2012 and we have implemented several projects. We have two pillars that we implement on. The first pillar is the primary health care part, and the second pillar is where we are doing the social determinants of health. Now, under the social determinants of health, that's where we deal with a lot of public health emerging issues. Now, we got a call from Ministry of Health to help them in responding to the emerging threats of cholera that were coming even at a time that we don't expect cholera to come in. We managed to get funding from David and Lucile Packard that supported us to help Ministry of Health to make the two border districts of Karonga and Chitipa more prepared in responding to cholera. Then two other emerging threats came in, Marburg and Mpox. These were reported in Tanzania, and we integrated this in our ongoing Cholera Response Project. With this support from David and Lucile Packard, we managed to train 300 health workers for them just to understand issues of Mpox and Marburg, but also cholera, so that we are more prepared as a nation. We also did a surveillance to assess their preparedness to deal with these emerging threats. Only 13% of these health facilities in the two districts were prepared, and we had to support Ministry of Health on how to deal with the gaps that were identified.
We have registered 67 cases, out of which we had 3 deaths. Amref has supported us with some trainings. So the support has come timely because that will boost our response plan. So our health workers will have been equipped with the necessary knowledge to make sure that we are up to date in terms of case management.
We learned a lot on the preparedness of cases of cholera and other threats. We are distributing water guards, chlorine, then advising people to wash hands, having toilets.
Karonga has a lot of hotspots where there is a risk in terms of transmission of cholera. Amref was managed to train 175 health workers from all over the facilities in Karonga to fulfill the Malawi Development Goal 2063. At the same time, MDGs number 3. Definitely, we can say we are now able to stand alone when we have these cases of Mpox or cholera.
We are very happy that Karonga and Chitipa are more prepared now than they were before to be able to respond to all these emerging threats that would come in these two districts. Beyond that, the project also ensured that there is a cross-border engagement between Ministry of Health in Malawi and Ministry of Health in Tanzania, where the two came up with a framework of how they will be engaging and collaborating whenever there are threats on either side.
We agree on how the two countries can collaborate in trying to prevent cross-border spread of diseases. Together, we achieve our goal of making sure that we prevent spread of diseases and improve the quality of life for our communities.
We'll need to do similar work in other border districts. That will ensure that Malawi is more protected, and we'll make a call to other donors to come in that we can continue with this work in these other districts. Thank you.